We are continuing to monitor coronavirus, COVID-19, words we hadn't heard about just a few weeks ago, and now they're just as common as can be. Getting us through this process is critically updated information, and we are happy to have with us in studio today Alan Levine, the CEO, the president of Ballad Health. Ballad Health, basically in helping us keep hospitals functional all across Northeast Tennessee, Southwest Virginia, serving Western North Carolina, serving Southeastern Kentucky. Thank you for being here today.
Pleasure to be here.
So much is changing, so we want to make sure that if you're watching this, point in time is around 2 p.m. on Wednesday the 17th, and things could change within the next few minutes, it seems. Let's talk about the most current information. And to me, it seems that your health system is joining with the Tennessee Department of Health, the Virginia Department of Health, to get testing happening more quickly and more easily accessible to the community. Where do we stand right now when it comes to testing for COVID-19?
Well, first I have to say our team has done a great job, I think, of creating a process so that people can be appropriately screened. I know you've been promoting the telephone number that people should call if they feel symptomatic or if they feel like they've been at risk. Using that phone number, we have nurses and doctors that can screen patients, and then if they feel, based on the algorithm that has been approved by the CDC or it's in guidance by the CDC, then we refer people to the appropriate location for testing that's most convenient for them. We've had that capacity now for several weeks, and we've been doing it. We've tested almost 30 people, and so far we haven't had any that Ballad has tested. We haven't had any that have been positive, with the exception of the one from Sullivan County early on.
And that was never a treated patient in your system, right?
That's correct. That person was cared for at home. So we have stood up, along with our friends at ETSU, we've stood up several, we have 12 locations throughout the region, Southwest Virginia and Northeast Tennessee, where people can drive through. We also have all of our emergency departments that are capable of doing the testing. So the capacity here has always been here. Really the limitations on testing started out being a lack of testing kits. That was a national problem. Then once the testing kits were deployed, the state departments of health were able to do the testing, but then they hit capacity. So then the private labs stepped up their ability to do testing. Now they're hitting their capacity, which slows it down a little bit. Now you got to deal with shortages with personal protective equipment that you see the nurses wearing, and shortages of the supplies that are needed to do the test. Those are really the limitations. So far in our region, we've not hit those limitations. We've got the supplies we need. So testing hasn't really been a challenge here. What I would encourage people to do, if they feel symptomatic or if they feel they've been exposed, to call our phone number that we've been publicizing.
And we can put this up and show people again so they can see it.
That's our Nurse Connect. It's nurses, it's doctors who can do a proper screening using our algorithm and then refer you to the closest and most convenient location for you for the testing. So that I think we're okay with that right now. It's been a bigger challenge in more urban areas where there hasn't been enough supplies or enough testing equipment or capacity. But here, I don't think that's really been our limitation.
You know, I'm sensing from some, you're on social media, you hear discussions, the desire that everyone would be testing, carte blanche, that there would be a widespread, systematic approach where thousands of people a day would get swabbed and get the results in a few days. The governor was very clear yesterday. He said, based on the knowledge he's been given, everyone doesn't need to be tested at this point, that only the highest risk or the most prioritized patients to be tested. Help us understand what you think. What are your professionals telling you?
Well, there's a window where you have symptoms, or there's a window from when you become infectious to when you're no longer infectious. And if you just test everybody, you're going to miss a lot of those windows. You'll have a lot of false negatives. I don't think that's the right solution. That's never been the right solution for an infectious disease event. The most appropriate thing to do is to target those who have been exposed or who have been at risk of exposure, test them, isolate them, and when you get the results back, if it's negative, great. If it's positive, then you keep them isolated or provide treatment in an isolated environment. That's the way you slow down. You can't stop an infectious disease event where nobody has, where nobody's been vaccinated and we're all subject to it. You can only hope to slow it down. And from a healthcare perspective, that's the most important thing. And frankly, the public's done a great job of responding to the call of social distancing. That's the single best weapon we have to keep the healthcare system from getting overexposed. Look, the reality is there's only so much capacity. We have more than 200 ventilators. 150 of them are available right now. We have 200 ICU rooms. We know what our capacity is, and yes, there are capacity limits, and so the way you manage that capacity is you manage the demand. And the way you manage the demand is social distancing, slow the spread down so that the health system has the capacity to treat people who need to be treated. And look, there's a lot of economic wreckage happening out there right now. Right. Small businesses, people who have spent their whole life building a business, who are watching it disappear before their eyes. And this is serious. If it wasn't this serious, people would not be being asked to do all this. But that's our biggest concern right now is the testing isn't as much an issue. I wish the testing results could be delivered faster.
What are we dealing with in a time frame here?
Private labs, it'll take 4 to 5 days right now because of the load that they're bearing. There's a lot of work being done to speed that up, and hopefully in the next week we'll see some movement. The next challenge we have obviously right now is, believe it or not, the blood supply is a major challenge. Jerry Caldwell, the CEO of the Bristol Motor Speedway, he and I spoke this morning, and he's been kind enough to offer to host a blood drive at the Speedway.
That's fantastic.
He's working on the details for that right now, and he'll make those announcements with Marsh. But
and just so we're clear, it's because many organizations that had planned those drives canceled them.
That's right. For instance, schools closing, one of our biggest sources of blood contribution during the spring is high school blood drives. Well, with the schools being closed, those blood drives aren't happening, right. And unfortunately, the demand for blood is still there, and so that becomes a challenge. And of course, we're also now our emergency command center at Ballad is working collaboratively with ETSU, the health departments, to plan for what occurs in the event we start to see cases that need to be hospitalized. And clearly, our most important issue, Josh, is to protect our healthcare workforce. That you don't realize every day those nurses and doctors and support personnel, every single day, even without this pandemic, they put themselves at risk all the time. They're exposed to all types of things every day.
How are you protecting them? Because I'm thinking many of them probably fall into that 60, not many, but a portion falls into that 60 and above.
That's true.
Falls into that issue that they're already dealing with their own personal health issues while working to care for others, and there they are on the front line. How are you protecting them?
Well, for one thing, that's why we've done the limitations on visitation, both in the nursing homes, long-term care facilities, and in the hospitals. And I know that hasn't been terribly popular with some people, but that's designed to protect our healthcare workforce. Now look, if we start to see a spread, we may have to stop all visitation. I mean, and those are the things you have to do everything you can to protect the workforce. We're not perfect, okay? This is a pretty big event, and there will be opportunities for us to make mistakes along the way. I think what is most important is that we are transparent with what we're trying to do and why we're trying to do it. Think about this. There's a shortage of personal protective equipment. If you do massive testing, we're burning through personal protective equipment before we've even had the first patient in the hospital. And so part of the thing we're balancing is we don't want to see our supplies diminish when then all of a sudden, if we have patients that need to be treated, we need those supplies to protect our workforce.
Let me go back to one thing you talked about, and that's regarding testing. And then I want to backtrack through a few things you're covering. Can you give us an idea of how many people, and I know this is ballpark, but scale is something I'm struggling to understand. How many people are getting tested at this point in the game? Are we talking a few dozen a day, approaching 100? Where are we?
In the last 2 weeks, we've tested just under 30 people. We've had one positive, which resulted from the one case in Sullivan. That was early. We haven't had a positive case since. We've had roughly 3,000 calls to our Nurse Connect call center, and that gives you, right now, that gives you it gives you good visibility into what we're seeing, which is there's no evidence right now that we have a spread in our community. And I think that's largely because people are heeding the call. They're doing what they've been asked to do by social distancing. And in a rural area, you don't have as much density in the population like you do in the urban areas. If you look what's going on in New York right now, it's getting very serious.
Much higher rates of.
That's right.
So 3,000 ballpark calls, 30 some tests. Only one confirmed that's come out of that testing
That's
group.
right.
That says to me, bottom line, the community spread, and that's the new term we're also learning, that's where people are just spreading it person to person.
That's right.
You've not traveled overseas and got it and brought it home, or that you're an isolated case. That seems like good news. What I'm also hearing is, don't be fooled by that good news. Don't relax. Is that good guidance in your opinion?
Yeah, I think what we're doing right now is working. That does not mean that because it's working today, it will still be working tomorrow. I do believe we will see cases in this region, and I think because we don't have any right now but that one, if we do get a positive, the health department will go very quickly to do what they call tracing. They will go meet with that family, they'll isolate the family, they'll find out who they've come into contact with, and they will go contact those people and keep an eye on those people and keep them isolated. That's how epidemiology works. When you have a case, if we had a large community spread going on right now, it'd be very hard to do that. But at the very beginning, when we have that first positive, the health department will move quickly to isolate and to trace. And when they do that tracing, that's what prevents the spread. So what we're doing right now here is working. And it's working because the community has done what we've asked them to do. And I got to tell you, on behalf of our 15,000 team members and nurses and doctors, we're grateful that people are doing it, because that means we will be better prepared to take care of those who ultimately might need hospitalization.
Do you go ahead?
No, go ahead.
I don't want to interrupt you, but do you think it's still fair and accurate? This is what we've been telling people now for a few weeks, is that for the vast majority of the people who are COVID-19 positive, that you will have maybe almost no symptoms, up to manageable symptoms. By vast majority, we're talking ballpark 80 to 85% of cases who are positive, who get it, can stay at home, isolate, self-care, stay hydrated, pop a Tylenol if the fever gets really high, that type of stuff that you normally do. Is that still the truth based on what you know?
Most of that is. I would say that the data seems to be showing that 80% or more of those who are infected have very few symptoms. I wouldn't necessarily be prescribing Tylenol at this point, because there's still questions about what the right medication is. Right. But you know, here's the modeling that we're going through right now. Okay, if we have 1.2 million people in our region, and if there's a 30% rate of spread, right now they're saying if you do nothing, there could be a 60 to 70% rate of spread. If you do active, aggressive social distancing, you're looking at maybe a 20% rate of spread. So in our modeling, if you do a 30% rate of spread, you're talking about 360,000 people being affected by it. So if you just do the math, if 5% of those people need or have severe symptoms that need ICU level of care, you're talking 18,000 admissions to the hospital. If you're talking 20% need hospitalization and some subcomponent of that need intensive care level of care, you're talking 30,000 or more people that need hospitalization. So that's why minimizing the spread is important. I think that what I'm about to say is forward-looking. I have no data to support this. But if we see a lower rate of spread because we're rural, because we're doing all the social distancing, that's a good thing. But the other part of the news that is not so good is that we have a very high rate of people that have obesity, that smoke, that have COPD or heart disease, and those issues actually make the severity worse. So while the rate of spread may be lower here, is what we're hoping for, the severity could be higher, and that's what we've got to be prepared to take care of.
You're saying the pre-existing, I've heard the term comorbidity, the issues that we are dealing with here in rural Appalachia, the diabetes, the fact that we're carrying a few extra pounds, some of us many extra pounds, those things that are overall contributors to a lack of wellness, that's an issue here. It makes it harder for you to maybe bounce back if you're diagnosed with COVID-19?
I think it's making it more. I think it's making it more severe if you are exposed to it, and those are the populations that we're concerned about. The elderly who have comorbidities, as you mentioned, or even younger people. You know, there's a lot of conversation that younger people, the mortality is much lower. That seems to be true. But what we don't, this is not the flu, and I keep trying to reiterate that to folks. Comparing it to the flu isn't the right thing to do. It is a respiratory condition, but it's not the flu. It is a new novel virus. We don't know enough about it to make determinations about what the long-term effects are on your lungs. We're still learning a lot about what treatments are appropriate. There's a lot of work being done on that. But the population that is most of concern is the elderly and people who have all of these co-conditions, or any of these: diabetes, obesity, COPD, congestive heart disease, or heart disease. Those types of things do make it a more severe event if you are exposed to it.
You brought the flu up, and I want to go there, and I don't want to go down a rabbit hole, but you've worked in politics. You've been in administrations for 2 governors. So you know what a political football this has become. And I keep hearing this sometimes subtle insinuation, sometimes just blatant statement that this is somehow or other been overblown, manufactured, we're overreacting, we're freaking out unnecessarily, and somehow or other that may have a political tie, or maybe this is just the media. We're hearing that a lot. From your perspective on the inside of the healthcare industry, are we overreacting? March Madness was canceled. You know, there's kids' schools shut down, families, spring breaks, everything really, truly, profoundly impacted. And there are people who are saying this is an overreaction. What do you say?
I think if we look back at this event and say we overreacted, that means that we were successful. This is an international issue. The World Health Organization has called it a serious event. If you look at what's happened in Italy, if you look at what happened in China, you look at what's going on in New York and up in Washington State. I mean, taking steps to stop a virus that no one has an immunity to, you can't overreact to that. What you don't want is 90 days from now to look back and say, look at all these people that we lost. Why didn't we do something about it? Mm-hmm. So in public health and in dealing with infectious disease events, if you can look back and say we overreacted because no one died, man, that to me is a success. And I know, look, I get it. This has affected my family as well. Mm-hmm. And it's well, I don't know what else to say. I mean, it sucks. Mm-hmm. But it is what it is. And if we want to protect the people we love, we've got to do what we've got to do to protect the people we love. And I have to say, the people in this region, and frankly all over the country, I think while there may be politicians who politicize things, the public isn't. The public is doing what they've been asked to do. They're doing it, I think, generally without panic. And I think, frankly, I've been inspired by what I've seen in the community. I mean, there've been one-off examples of people who've maybe have said things that were irresponsible, but I think generally speaking, the public's pretty smart. You know what we owe them is transparency. We have to tell them where our limitations are. We have to tell them what we're doing to try to help. We have to be candid if we make a mistake and say, oh, that was a mistake. I don't think anyone's expecting that Ballad Health or any health system is going to be perfect in this. What they expect is honesty and candor about what we're doing. And frankly, in a public health event, nothing's more important. What we tell people to go to www.balladhealth.org/COVID-19. We're putting information on there that's been vetted as being accurate. There's a place you can click if you have any questions so that we can get you the answers that are vetted and accurate answers. The worst thing that can happen is misinformation because it causes panic. And to me, social media, while it's a really great tool for a lot of things, it's also a way for, it's a hyper mechanism for bad information to be spread or for irresponsible information to be spread. And what I would tell people is, don't just look at one source. If you see something, go to 2 or 3 reliable sources and validate it, or go on our website and ask the question, and we'll get you the answer. If we don't have the answer, we won't make it up. We'll tell you we don't know the answer. Mm-hmm. But in a public health event, people have to trust the information they're getting from their leaders and from the people that are entrusted to care for them.
We have just a few minutes left with you, maybe 1 minute left before I know you have to run. Final words to people. I know you're asking healthy people to donate blood. That's mm-hmm. urgently needed mm-hmm. because the drives have stopped. Final word, you call 833-8-BALLAD. If you think you have symptoms and you want to be pre-screened and possibly get tested, Is there one other thing that you think is critically important for people?
I think just keep monitoring the situation, follow the facts, and just keep doing what you've been doing. I know there's going to be a lot of fatigue with this, but this is a marathon, not a sprint. And I know as time goes on, it's going to get more and more difficult. And and I guess bottom line is, if you have neighbors, I would say this: if you have a neighbor or a friend who's a healthcare worker and they have young children, it would be great if you would volunteer to help care for their children so that the healthcare worker can come to work. The worst thing that can happen to us right now is that our healthcare workforce diminishes because they got to deal with their children at home. So that's one thing I think people can do in addition to what they've already been doing. Is any healthcare worker that you know of that you want to help, if they have young children, just reach out and ask them if there's anything you can do to help take care of their kids while they have to work.
And is this a few weeks? Or do you think this could be a few months or several months? Where do you think we are?
I'm not in the business of predicting nature. I think the president has said it could go through July or August. Here's what typically happens until there's a vaccine. There's this first phase where we're trying to tamp down the spread. At some point, it could be that it gets stabilized and then you sort of loosen up on the social distancing, but then there will be another phase. So until there's a vaccine or a known treatment, I think this is going to be with us, because it's still going to be out there, and there's still going to be a likelihood of spread. So I think for the next month or so, you will see more of an effort to keep the social distancing and to tamp down the spread. I think at that point, hopefully we'll get closer and closer to a vaccine. Right now they're saying about 12 months to 18 months for a vaccine.
Alan Levine, thank you.
Thank you.
We are turning you to you for updates, so we appreciate the accessibility.
Happy to do it and appreciate the work you guys are doing.
The CEO of Ballad Health will continue updating information and keeping you updated on the air and here on WJHL.com.